As that new COVID-19 mutation hits the U.S., the first known case reported in Colorado. The patient now in isolation as a man in his 20s with no travel history. Experts saying it could be much more contagious. Let's go to Kaylee Hartung in hard-hit Gardena, California with the very latest. Kaylee, good morning.
Yeah, good morning, Whit. Things have gone from bad to unimaginably worse here at Memorial Hospital just over the last 2 weeks. This hospital, it's at capacity. And yesterday we were here. We watched ambulances line up, some waiting for hours for a bed to become available. This hospital says the breaking point, it's here.
This morning, Colorado reporting the first known case in the U.S. of that new variant of the virus, which the CDC says could be far more contagious. Health officials say the patient, a man in his 20s with no travel history, is now recovering in isolation. Officials say a second possible case with links to the same small town was reported, but is not yet confirmed. New research finds the new variant isn't more deadly, and experts believe the vaccine will likely be effective against it. This as the virus claims the lives of some younger patients.
What's surprising also are patients who are coming in their 30s and 40s who are truly symptomatic and requiring oxygen.
Overnight, Louisiana Congressman-elect Luke Letlow dying from COVID at just 41 years old. He tested positive on December 18th and was admitted to the hospital the next day. He died just 10 days later. Just days ago, he urged those who'd recovered from the disease to donate plasma, tweeting, "I cannot stress this enough. Please consider saving lives by going out and donating at your local blood bank." And as the nation mourns record death tolls, hospitals in California are hitting a breaking point. The number of daily hospitalizations in Los Angeles County, nearly a 1,000% increase from just 2 months ago.
I just look back on New York City and Italy, and that's what we feel like right now. After the Christmas holiday season, I'm scared to death, honestly.
Memorial Hospital in Gardena is now at capacity. Ambulances forced to wait in line.
It's nonstop. It's not unusual to get 8, 9, 10 ambulances backed up here.
The hospital needs more beds, more staff, and more oxygen to care for the dramatic influx of COVID patients.
If we can't keep an adequate supply of oxygen, patients are going to die. We have plenty of ventilators, but if I run out of oxygen, the ventilators are worthless anyway.
In just a matter of days, Los Angeles County alone is expected to surpass 10,000 deaths related to COVID-19. State health officials outlining plans to ration hospital care if the surge worsens. Nationwide distribution of the vaccine brings hope and end is in sight. Vice President-elect Kamala Harris received her first dose yesterday. But even so, President-elect Joe Biden is warning that holiday travel may delay the country's improvement.
So we have to anticipate that the infections over the holidays will produce soaring cases counts in January and soaring death tolls into February.
Now, triage tents like this one have helped hospitals throughout Southern California manage the flow of patients into their hospitals. But only so much patient care can actually happen here. So now the head of this hospital, he is calling on local officials for help. He wants alternative care sites set up. Think about convention centers, arenas. That's how much help, how much more space is needed as this situation continues to get worse. TJ?
All right, Kaylee, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.